Welcome to Medical Licentiate Emerson Educational Channel. The period after childbirth, often referred to as the fourth trimester, or postpartum, is a time of immense change, both physically and emotionally. While it is typically associated with joy and bonding with a newborn, it is also a period of significant vulnerability for mothers. Hormonal fluctuations, sleep deprivation, and the demands of caring for a newborn can take a toll on a woman's mental well-being. During this crucial time, it is essential for healthcare professionals to be aware of the unique mental health challenges that women may face. Postpartum psychiatric disorders, encompassing a range of conditions from mild mood swings to severe psychosis, can have a profound impact on both mother and child. Understanding these disorders, recognizing their symptoms, and providing timely intervention is crucial for ensuring the well-being of mothers and their families. This guide serves as an essential resource for medical students and practitioners, equipping them with the knowledge and tools to navigate the complexities of postpartum psychiatry. By recognizing the unique vulnerabilities of the postpartum period and the spectrum of psychiatric conditions that can arise, healthcare providers can play a vital role in supporting mothers during this critical transition. Baby blues is a common and temporary emotional experience that many women encounter after childbirth. Characterized by feelings of sadness, irritability, anxiety, and tearfulness, baby blues typically emerge within the first few days after delivery and subside within a week or two. These emotional fluctuations are attributed to the dramatic hormonal shifts that occur after pregnancy as the body returns to its non-pregnant state. The rapid decline in estrogen and progesterone levels can impact mood and energy levels, contributing to the emotional roller coaster of the baby blues. It's important to note that baby blues are considered a normal part of the postpartum adjustment and typically resolve on their own without the need for medical intervention. However, it's crucial for healthcare providers to educate new mothers about baby blues, normalizing these feelings and reassuring them that they are not alone. While baby blues are common and transient, some women experience more persistent and severe mood disturbances. Postpartum depression and postpartum anxiety are two distinct but often co-occurring conditions that require careful attention and intervention. Postpartum depression is characterized by persistent feelings of sadness, hopelessness, loss of interest in activities, changes in appetite or sleep patterns, difficulty concentrating, and excessive guilt or worthlessness. These symptoms typically emerge within the first few weeks or months after childbirth, but can manifest up to a year later. Postpartum anxiety, on the other hand, manifests as excessive worry, fear, restlessness, difficulty sleeping, and physical symptoms like a racing heart, dizziness, or shortness of breath. Women with postpartum anxiety may experience intrusive thoughts or images, often centered around fears of harming the baby or something bad happening to the baby. Postpartum psychosis is a rare but serious psychiatric emergency that requires immediate medical attention. Characterized by a sudden onset of psychotic symptoms, including delusions, hallucinations, disorganized thinking, and bizarre behavior, postpartum psychosis typically emerges within the first 2 weeks after childbirth. Women experiencing postpartum psychosis may have delusions about the baby, such as believing the baby is possessed or in danger, or they may experience hallucinations such as hearing voices telling them to harm the baby or themselves. Risk factors for postpartum psychosis include a personal or family history of bipolar disorder, previous postpartum psychosis, and first-time motherhood. Due to the severity of the symptoms and the potential risk to both mother and child, postpartum psychosis requires immediate hospitalization and treatment with antipsychotic medications and mood stabilizers. Section 5. Building a safety net, treatment and management. Addressing postpartum psychiatric disorders requires a multifaceted approach that combines pharmacological interventions, psychotherapy, and social support. Antidepressant medications, such as selective serotonin reuptake inhibitors, or SSRIs, are often the first-line treatment for postpartum depression and postpartum anxiety. Psychotherapy, particularly cognitive behavioral therapy, or CBT, can be highly effective in helping women identify and manage negative thoughts and behaviors. CBT focuses on developing coping mechanisms, improving communication skills, and enhancing problem-solving abilities. In addition to medication and therapy, social support plays a crucial role in recovery. Encouraging women to connect with other mothers, join support groups, and engage in activities they enjoy can provide a sense of community and reduce feelings of isolation. Section 6. The doctor is in recognizing the signs. Early identification and intervention are crucial for improving outcomes for women with postpartum psychiatric disorders. Healthcare providers play a critical role in screening for these conditions during prenatal and postpartum visits. Using standardized screening tools, such as the Edinburgh Postnatal Depression Scale, can help identify women at risk. Additionally, open and non-judgmental communication is essential for encouraging women to share their concerns and seek help when needed. Be alert for signs of withdrawal, changes in mood or behavior, and expressions of hopelessness or despair. Remember that fathers can also experience postpartum mental health challenges, so it's essential to include them in conversations and screenings. Section 7. Collaboration is key. A multidisciplinary approach. Treating postpartum psychiatric disorders often requires a collaborative effort involving healthcare providers from various disciplines. Psychiatrists, obstetricians, pediatricians, nurses, social workers, and therapists can work together to provide comprehensive care. This multidisciplinary approach ensures that all aspects of a woman's well-being are addressed, from medication management to therapy to social support. By working together, healthcare providers can create a safety net of support for mothers and their families. Regular communication and coordination among team members are essential for ensuring continuity of care and optimal outcomes. By sharing information and collaborating on treatment plans, healthcare providers can provide the best possible care for mothers during this vulnerable time. Section 8. Breaking the silence. The importance of support. The stigma surrounding mental health, particularly in the context of motherhood, can prevent women from seeking the help they need. It's crucial to create a safe and non-judgmental environment where women feel comfortable discussing their struggles. Encourage open communication and active listening. Validate women's experiences and let them know that they are not alone. Provide information about available resources, such as support groups, hotlines, and online communities, where women can connect with others who understand what they are going through. Remember that seeking help is a sign of strength, not weakness. By breaking the silence surrounding postpartum mental health, we can create a culture of support and empowerment for mothers. Section 9. A call to action. Prioritizing maternal mental health. Postpartum psychiatric disorders are common and treatable, yet they often go unrecognized and undertreated. As future healthcare providers, it is our responsibility to prioritize maternal mental health and advocate for the well-being of mothers and their families. By educating ourselves about these conditions, recognizing their symptoms, and providing compassionate and evidence-based care, we can make a significant difference in the lives of women and their families. Let us work together to create a healthcare system that supports mothers during this critical time and ensures that every woman has access to the care she needs to thrive. Remember, a healthy mother raises a healthy child. Let us prioritize maternal mental health and create a future where every mother feels supported, empowered, and equipped to navigate the joys and challenges of motherhood. Thank you for watching Medical Licentiate Emerson Educational Channel. Please subscribe and like this